I'm Dr. Ali Bostani, the founder of DRPAL, and today it's actually a big day for us. We're very, very excited for this AMA, and we're going to tell people that what are the great things which are ahead of us that we can do together with Lyft. Actually, you're absolutely right. You know, when we started this journey a year ago, we were just thinking of creating a tool to help doctors because we saw gap in healthcare. One of the gaps that we were seeing in the beginning was the language barrier between doctor and patients, number one. Then the miscommunication between the doctor and patients. And we realized that that's a lot of time patients are not getting the care that they need and they deserve. And sometimes the patients are simply just shy just to share their concerns, their medical issues, their health problems with the doctor. So actually we did see that there is a gap, but and we were in the beginning, we were thinking that it's going to be very easy. Everybody wants it. But as you said, when we started last year, we created a tool that later on I'm going to explain to you the first tool that we created, which actually was the main engine behind the thing. When we approached the first hospital, one of the things that we noticed that sometimes the doctors are feeling a little bit threatened by this because the doctor might think that, okay, AI might replace them, and the AI might be in future that we might not even need doctors. AI can take their jobs. But the whole idea of DRPAL is coming from this, the AI is going to be the pal of the doctors. The AI is going to be an assistant to the doctor, but the AI is going to make sure that the patients will deserve. Look, the way that I look at it, to be honest, Lyft is leading the way in AI-driven fitness, right? And DRPAL is transforming AI in healthcare. So the way that I see it together, we're creating an ecosystem where AI doesn't just react to health issues, but actively helps prevent them. Like imagine personalized fitness and health plans that adapt in real time, combining AI, blockchain, and real-world data, like to improve people's well-being and health together. If I may add to this, that what Ben said is actually one of the mutual concerns that we had with Lyft, and that's why we believe that with the ecosystem that Lyft and DRPAL will do together, we're going to overcome this issue. Let me tell you an interesting thing. When we started to work on health and AI agents for health, and this, one of the things that we noticed was, you know, everything about AI is about data. So good input data will give you good output results. When it comes to health, the good data, the reliable data is lacking because hospitals, health institutions, they have concerns, they have privacy issues, they have concerns, they have legally, they are not allowed to share the data with research institutes, with companies here and there. So what Ben said is actually what we're gonna try to do together. So it's we believe that every single person, legally, ethically, humanistically, everything, the person will to own his own health records. So what we're gonna do later on, we're gonna create an NFT from everybody's health record. So everybody will own that health record on blockchain. And if I want to share my health record with an institute, with a research institute, with a company, I can monetize it. So it's a treasure that we all have and we never used. And when I want to share it, I will definitely eliminate my sensitive data and share what I want to share. So this way, I will ensure that my identity is not being compromised. Nobody's going to have access to what I don't want to give access to. Meanwhile, the institutes, the LLMs, the machine learning platforms, everything will have access to authentical data. This is one of the things which is coming soon in the future, and that's confirming what Ben said. Blockchain is the answer to that. Let me start like with a little bit background about where we Dr. Pal started. And it was, if you remember, I started to beginning that we had an AI agent to introduce to the hospital, and that AI agent was working based on a speech recognition system that was recording the session between the doctor and the patient and was extracting the important data from this conversation and was offering the doctor with an SOAP, subjective objective analysis and plan, which was giving the doctor already while in the session a plan to how to treat this patient, and definitely summarizing, and was summarizing also the whole session to be put in the folder to the in the records for the next visit and these things. Meanwhile, while the doctor was starting to prescribe a medicine or starting to give advice to the patient, our agent was looking into the history of this patient and was giving doctor also advice. For example, be careful, this patient might be diabetic, so you have to make sure for the drug interaction and these things. So it was solving multiple issues for the doctors. Number one, it was solving the language barrier, because all around the world, we see that the doctors might and patients might not understand each other's accents, and the lack of communication might result in the lack of understanding, and lack of understanding might result in the wrong prescription and wrong treatment of the patient's problem. So this, actually, a few of the specialists in our team are PhDs in speech recognition. What we created with a very, very high percentage and with very little error can recognize any different access from any part in the world, and it works in any language. And this was a big advantage to make sure at least there is no misunderstanding based on the language barrier. Second thing, it was making sure that the doctor will not get sued for no reason because he just was simply lazy or didn't have access to the patient's record. So AI does this for the doctor, checks the patient record, and it's not going to prescribe the wrong medication, which is having interaction with what he's having already, or with one of his allergies or one of his chronic diseases or something. And the third thing was it was saving doctor time. So based on the doctors who are using actually our solution, we saw that in a 15 minutes doctor patient visit, we will save up to 4 minutes. So it's going to be translating into more money for the doctors, number one, plus less waiting time for the patients. And this was the original thing that we started with this AI agent. The Dr. PAL core was based on this solution. And we're proud to say that this solution is already starting to be profitable, and there are doctors in a few countries which are using it and which are very happy with it. They're addicted to this, so they think that it's something that they always needed, and they're happy that they're having it right now. But after that, what we started to integrate this blockchain idea into our solutions, every day we realize that what a huge impact we're going to have. We are actually trying to pioneer in integration of real world assets with this AI using NFTs for verified health records. And later on to go to the AI-powered DeFi solutions and even personalized cosmetic surgery recommendation, for example. Other issues like this, I'm going to explain more about the things that we never thought of, but AI can actually resolve them. And one of the most important things that is going to be the help is going to be real time. How many times you have heard that this guy, if he had known it earlier, if he had seen a doctor an hour before, a day before, a week before, his life could have been saved. So we believe that we're going to save lives this way. Absolutely right. This is we are coming from a real concern, and we believe that we are doing something for the benefit of the people. And we are very happy, to be honest, that we think that we are right on time. So we are capitalizing on the capabilities of AI for doing that. Like, for example, I'm just going to give you an example. A few days ago, in one of the meetings that we had with a few of our specialists, one of our dermatologists, he was telling me something that actually where his mind was blown when I told him that we are actually working on this tool. He told me, look, did you know that some of the people who come to us, to our dermatologists, they just come for STDs, but most of them, they are very concerned about their identity. They don't want anybody, they're shy, they don't want to share this problem, but they might have had something risky or something, and they're worried, they don't want to catch any disease or something. They want to see if they want to be diagnosed early. What should we do? But and they start to beg us, please make sure my name is not anywhere, my name is not recorded, this. And I told him, look, when I tell you we are working on a blockchain system, for example, one of the things that we are working on is a telehealth system in which when you contact the doctor, the first few minutes, you're just talking to AI. You're just describing everything for the AI. And AI is going to summarize it for the doctor. The last minute only, you're going to talk to the doctor. But since how they're going to know your identity, either you're going to give your ID, or you're gonna, when you pay with your credit card, they're gonna know who you are from your credit card information. But when you are in the DRPAL ecosystem, you don't need to use your ID. You can just totally be anonymized. And when you're gonna pay, when you pay with DRPAL, nobody's gonna know who you are. They're just gonna know your wallet. They don't know what's your identity. So you're sure that you can share actually your disease, that you're not gonna get later on, you're not gonna end up having HIV, for example, because simply you were shy just to talk to a doctor. So we, as you also mentioned, we think that this can save lives. Look, in the preparation of the health chain in general, so we have already evaluated the best solutions, and we do have several options in mind. As we move forward, of course, we will inform the community how it works. But the strategy and the vision behind it, as I said, is everybody's own health records will be NFT'd and can be monetized, number one. And this tokenization is going to help us to ensure that the ownership of the health record of everybody, and certainly when they use our ecosystem for constant checkups and the visiting doctors and these things, and definitely when everything is being added to their file, they read constantly their NFTs are being reevaluated and basically is being enriched. That's the idea. That's the idea, that the data, all these health records data, are going to be stored in the blockchain. So the security of the data and then the integrity of the data will be 100% guaranteed. Look, one of the other important things is here that when we store things on data, and when we store this data on blockchain, nobody can actually use falsified data to report wrong studies or to report studies which actually are not correct. So when the data are recorded, they cannot be altered when they are being blockchain. This is very important, when especially when it comes to the health records, because you and everybody knows that there had been studies that, because of the wrong data, because of the lack of the integrity in the data, the result of those studies ended up developing wrong medications, wrong vaccines, again, I'm sure most of us can think of some examples here and there. And that's what we're thinking, that the integrity of the data is a huge deal and can be actually this way, it can be maintained. Yeah, no, no, absolutely. Actually, I wanted to actually confirm what Ben said about this, the ownership, the sovereignty of the data, and with this health chain that we're creating and the ownership of the NFT to be belonging to every single person, and the having the DRPAL token to be the currency within this ecosystem, that the payments can be done through this anonymization. Missing a link is gonna be resolved. So basically, as I just said as an example, in this telehealth system, this was the last thing that people could not get away from, that they had to pay at the end of the day, and they wanted to use a credit card, PayPal, whatever it is, so they would have been recognized. But this way, that everything was being anonymized. So this, I think this issue will be resolved. And but what you said, yes, you're right. There are so many red tapes when here and there in the United States, in Europe, everywhere. But again, I think Web3 and the blockchain, I think these two are the answers that we're gonna work hard, and we're gonna try to remove those concerns and continue our campaign. We're gonna show them that all we are our concerns are their concerns. We are concerned about people's privacy. We're concerned about integrity of the data. We're concerned about the quality of the care that people are receiving. And when our goals are in line, and I'm sure our efforts will be towards the direction that we will remove these red tapes here and there. And definitely we're going to work with the RTAs, with the regulatories, and here and there to allow us to do this, and to start with, that the products that we right now, this tab for the doctors that they use speech recognition, our SAAI Chrome extension, which is already in the market and people are using it. It's approved. It's being used in Canada already. It's being used in Kuwait already. It's being used, and it was approved by the health authorities with no problem. And I'm sure it's not going to take too long, because this is something that people need. And by this developing this NFT part, that everybody owning his own health records, I think the legal issues and the ethical issues will be resolved as well. Definitely, it's not going to be as simple as that. Lots of people are working behind this, as we're talking about from the legal perspective and these issues. But the ultimate solution is going to be there. Yeah, this is our main advantage over any other AI agent, that we are onboarding doctors of different specialties. We have a nutritionist on board already. We have dermatologist on board already. We have a neurologist on board already. We are having doctors on board already, which we are ragging the data. We're not just you can actually check our tools. We have different bots here that you can say. We have a bot right now, SAI bot on Telegram, that you can ask any medical question that you have in any language. It answers you right away. Just check it and compare it with the same answer. Ask the same question from DeepSeek or ChatGPT and compare it with our tools. You will see that it's different. It's actually like more professional, more personalized answer to your question. And sometimes we don't answer, we just ask for follow-up questions when it's needed. And all of this, it's progressing day by day. And you cannot imagine how many doctors are approaching us and they want to be part of this. And they are coming with amazing ideas. Like these days, we don't have enough. We have to start to hire more people, honestly, just to answer to these approaches that we have, and to unify the ideas here and there, to know, to see what directions to develop the modules that you are having, the ecosystem. For example, something very interesting which is coming soon is we are having a partnership with an Asian company which is making a wearable device and some glasses that in which when a doctor is wearing them, and looking on the patient's skin real time on the same glass, giving information about the possible disease or the condition of the skin and this to the doctor. And this data, again, since they are personalized data for this patient, is going to be the same health chain that we were just talking about and to be NFT to the same patient. So the combination of the wearable devices in general with our medical AI agents is something very interesting. And definitely this partnership with Lyft is one of the things which is empowering us to do such a thing, because they are amazing when it comes to understanding the data, manipulating the data, collecting the data, wrangling the data, and everything. So this is where we're going, and the direction that we're taking at this moment is a direction that I believe, and we're having this, I having this subjective opinion of many people that we're talking to them every day, that we believe that people are hoping to see soon. And the help of AI can make us achieve this earlier than what we expect. Yeah, amazing. Living to the moon, I love it, because we also say that together to the moon. So now together with the lift to the moon. Uh, First of all, we have filed a patent about uh, health record and blockchain and the NFT idea. So which is one of the news that we want everybody to know, that it's going to be a patented utility. And we are developing an app that is making the access to our all different bots easier. Maybe a lot of people here, they don't know. We have a nutrition bot, for example, that asks people some question and gives them diets based on their goal that they want to do. We have a bot here which is being released very soon, which is offering people the skincare routine. And we are having another a general healthcare question that we already have, that you can ask any health question from the bots. We have a Twitter bot actually that you might not have known. You just anywhere in Twitter that you are, just write at DRPAL _ AI and ask any medical question. It comes right there and answers you. If you're writing a post, it comes and comments on your post. If you're answering a reply, it's going to come and reply and you reply. So whatever in Twitter that you mention us, you can ask any medical question and we come and answer you right away. And these apps that we are developing, everything is going to be integrated there, all these tools, and you're going to have a dashboard with all these things that every day we're adding to it, of course. And plus, as I mentioned, that the partnership with Leaf, that what we're doing for the fitness and health together is gonna take us where not only we're gonna treat the patients with this correlation, with this partnership, we can actually help people to prevent a lot of disease when it comes to combine the fitness with health. Another thing that we are working is on the ways to connect actually DRPAL with insurance companies to provide them with AI assisted health assessments, basically, that can streamline approvals, reduce the costs, and provide better coverage and transparency, definitely. So later on, it can evolve into DeFi-powered health financing, if you wanna say, and it can allow patients to access funds for critical procedures more easily this way. So this is another vision that we do have for DRPAL and for the DRPAL token and the ecosystem.